Hey, my name is Adam Grice.
Hey, my name is David Luong.
Hey, my name is Kevin Pan.
And our topic is female health screenings for UTI, vaginal infections, and menopause.
Hey, my name is Adam, and I'm going to show you how to not take care of a patient.
I think I have a UTI, mister.
Dr. Evil, I didn't spend 6 years in evil medical school to be called Mr. Thank you very much.
Do you have pain or burning when you urinate? How about the need to urinate often? Or the need to urinate suddenly? You might have a urinary tract infection. You wanna know how to prevent this, I bet? Try urinating more often, idiot. Or maybe don't wear tight underwear, idiot. You should probably cleanse the area daily, sicko. Maybe you should wear cotton underwear for once. I would try not using those stupid hygiene sprays. Last but certainly not least, do not be a woman. Please. Well, now that you unfortunately are a woman, I mean have a urinary tract infection, I guess I can help you. I would suggest an over-the-counter test kit. The directions are on the box.
You won't explain to me how to use these?
Ugh, fine. I've obviously got all day. I'll read the box to you. You are going to want to wet one test strip by holding it in your urine stream for 1-2 seconds. Read the results at 1 minute for nitrite and 2 minutes for leukocytes. Match the color of the test strip pads to the color blocks on the foil pouch. If it reads positive, you should go to the doctor, which I suggest you do because UTIs can progress to serious complications, even death.
Oh wow, how do you even have a job? You are the most insulting person I have ever met. I am disgusted by you. I am going to file a formal complaint right now, idiot. But I am glad you warned me that this could lead to death, because you pretty much saved my life. But I'm still writing a complaint, jerk. But thanks again.
Hi, my name is David, and here's an okay way to counsel a patient. Oh, I didn't see you there. Let me finish what I'm doing right now. Okay, what did you need me for?
Well, I've been experiencing some hot flashes and night sweats. I've also been moody and irritable. When I'm trying to have sex with my husband, my vagina is very dry and my sex drive is non-existent.
I think you're experiencing some signs of menopause.
Oh, what does that mean?
Well, menopause is the permanent stop of your menstrual cycle after you haven't had your period in a year. It occurs around the age of 52 years in normal women. May I ask how old you are?
I'm 50 years old. Is there a test that I can take to see if I'm in menopause?
There is the Reveal Midstream Menopause test that detects the presence of FSH in the urine. If you obtain a positive result from this test, it indicates that you may reach menopause, and you should see your doctor for professional assistance.
I'm okay. Is there a way for you to walk me through how to use this?
So you're going to remove the test kit from the pouch, hold the thumb grip, and place the absorbent wake up the device into your urine stream for about 10 seconds. Otherwise, you can collect your urine into a clean cup and dip at least 4/5 of the absorbent pad into the urine for at least 10 seconds. Recap the device and wait for colored bands to appear. A negative test is when there is only one band. A positive test is when there are 2 bands, and if there are no bands, then you will have to repeat the test.
Yeah, I think I'm pretty sure I can do that. Just peeing on a stick, and if there are 2 bands, then I have menopause. Is there anything we can do about my symptoms?
Here are some tips for your hot flashes. Try to notice what triggers your hot flashes and avoid those things. Possible triggers to consider include spicy foods, alcohol, caffeine, stress, or being in a hot place. Dress in layers and remove some when you feel a flash starting. Use a fan in your home or workplace. For your vaginal dryness and low libido, a water-based over-the-counter vaginal lubricant like KY can help make sex more comfortable. For your mood swings, getting enough sleep and staying physically active will help you feel your best.
Okay, thanks. Goodbye.
Bye.
Hi, my name is Kevin. Let me show you how it's done. Hello, my name is Kevin and I'm a student pharmacist at Belmont University College of Pharmacy. What brings you in today?
It's a little embarrassing, but I'm experiencing some burning and itching in my vagina. There is also some redness and swelling. Intercourse with my husband was been quite painful and not at all enjoyable. When I use the restroom, there's a burning sensation as well.
Wow, it sounds to me like you're really quite uncomfortable. Let's see what we can do to help you today. It sounds to me like you have some sort of vaginal infection. Most yeast and bacteria are actually harmless, but when there's abundance of them, and pollen can occur and an infection can develop. We offer this vaginal health test that you can safely and discreetly perform yourself in the comfort of your own home. Does that sound like something you'd be interested in today?
Yes, definitely. I'll try anything that will help. But would you mind teaching me how to perform the screening as well?
Of course, I'll be more than happy to walk you through how to use the screening kit. So what you do is take the applicator out of the box and then put it into your vaginal wall and wait 5 seconds. And then once you do, and then you take it out and you look at the color change. So at the top of the applicator, there'll be a strip that changes color. So if it's blue or green, I'd be a little bit worried. That just means your pH is abnormal and that you might have to, I would definitely recommend you make an appointment with your physician in order for them to prescribe you antibiotics to help take care of that bacterial infection. But if the applicator is yellow, your pH is normal, but with those signs and symptoms that you described to me, it most likely is a yeast infection. And with that, we can explore over-the-counter options together. So I can also show you how the box looks like to make it easier to find. So this is what the box looks like. The brand that we carry is the Monistat Complete Care Vaginal Health Test. So, and then you look at the color change. This is the tip, and then if it's blue or green, then it's a bacterial infection, but if it remains yellow, it's probably a yeast infection. But if you have any trouble finding the box, let me know, and I can definitely help you look for the product in our store. Yeah, so with these vaginal infections, they're more likely to occur if you're on any antibiotics, if you have diabetes, if you are pregnant, if you are taking birth control pills, or if you have a weakened immune system. So that just means like when you're sick with a cold or something like that, or if you're on chemotherapy. So I also like to share some things that you can do in order to prevent getting vaginal infections in the future. So you want to eat a lot of yogurt, you want to keep the area cool and dry, switch to cotton underwear, avoid tight-fitting pants, don't sit around in your wet clothes for a long time. You want to also avoid scented tampons and pads, and it's recommended that you wipe from the front to the back. I know we discussed a lot today, so would you mind going over with me how you're going to use the screening test?
I would just put applicator in my vagina and then look at the color change. If it turns blue or green, I should definitely make an appointment with my physician. But if it remains yellow, I can probably come back and ask you for a recommendation for the yeast infection.
Perfect. So it sounds like you know what you're doing. I have your profile in our system. So would you mind if I called you in about a week to see how things are going?
Of course, and I can tell you really care about all your patients. I love visiting this pharmacy.
Thank you. I really appreciate that compliment. I hope you feel better real soon, and please have a wonderful day.